Our next guest is going to get us up to speed on an exciting event that wrapped up just a few hours ago. Yesterday, the Voice.Health hackathon took place at the Cambridge Innovation Center and was exclusively sponsored by Amazon Alexa. The team spent hours on end developing voice-based solutions to real curated pain points. The judges were blown away by the output from the voice hack. And lucky for all of you here, you'll be getting a sneak peek at 3 of the finalist solutions in just a few minutes. Watch closely and also take out your cell phones because you're going to be voting on the winning solution via live poll. First, please welcome the founder of Hacking Pediatrics, with one of the best names in the business, Dr. Michael Docktor.
Thank you. So I'm excited to be here. This is a pretty impressive crowd. Really just an amazing honor to be part of this experience, and the event yesterday was really something I hope to convey in a couple short videos that we'll show you. So again, our exclusive sponsor was Amazon, and we've been working at this Hacking Pediatrics thing since 2013. We say that we've kind of hacked the hack, and so for those that don't know what a hackathon is, it's really this condensed period of time where you have folks from different areas of the world, meaning not geographically, but clinicians, so physicians, nurses. In the case of yesterday, we had a child life specialist, and engineers, designers, entrepreneurs, and folks from really disparate areas of expertise, all working together to try and solve problems, in this case for pediatrics. So since 2013, we've kind of each year changed the model a bit to make it more curated, a little bit more condensed in time, so we're not giving up an entire weekend, which is hard for a lot of folks. And we've had these 7 distinct events over the last 5 years. So worked with Museum of Science. We had a hackathon for children where we created the Hospital of the Future using Minecraft as the building medium, which was really an amazing experience. We've worked with Microsoft, Hub Week, and some great technology companies like Amazon, Apple, Google. Over the last 5 years, we've had thousands of participants, and at this point now, hundreds of pitches that we've heard from folks that are just passionate about their ideas, and it's amazing what can be done in a very short period of time. I'm going to show a brief video on our experience yesterday.
Hey, I'm Carla Small, Senior Director of the Innovation and Digital Health Accelerator at Boston Children's Hospital. This is just an incredible week at Boston Children's Hospital. It was just over 2 years ago that we wrote the first healthcare skill for the Amazon Alexa. And here we are today. It's just incredible. We're at a hackathon sponsored by Amazon Alexa. And there are 75 different people here from clinicians and technologists and students, all working on developing skills that we think can transform patient and clinician lives. But this is just part of a bigger initiative. We're bullish on voice in the healthcare setting, really believing that it can transform both patient and clinician lives.
So thank you, Carla. You said that far more eloquently than I would have. So what I want to impress upon you guys is that yesterday was, really a 5 to 6 hour long event. But in this very brief period of time, we had 9 different teams really creating these, what I think are impressive solutions based on voice. And these are all use cases that we've kind of curated over the last several years. So you'll remember John referenced that we had an Alexa sort of ideation session a couple years ago, right before we launched our first healthcare skill. Over time, we've heard from our clinicians, from our friends and family patients, all, where are the pain points that we can solve with voice? And so we curated that list of potentials down to just 9 use cases, and we split those teams up. So each of these teams had 4 or 5 people, a nurse, a doctor, a child life specialist, a social worker, an engineer, a designer, an entrepreneur. They're all these different folks from different walks of life together in a very brief period of time trying to create what I think is a really compelling solution. So I'm just going to go through each of these things real quickly. So starting off with post-discharge. So again, these are the potential use cases where voice can really have a tremendous impact. Post-discharge management instructions and how do we guide patients through the issues that they might face after a surgery, for example. How do we kind of help folks relax through meditation, through breathing exercises and guided meditation during a treatment. So like in the case of a child who might be getting an IV or having a procedure. How do we proactively remind folks about the issues that they might face post-acute or post-procedure? How do we capture non-urgent questions? So what do we do about the patient or the family that's in their hospital bed or their hospital room for days or weeks on end? And what are the questions that they might face in their day-to-day activities? How do we address the child who is unfortunately in the hospital on his or her own, and parents are off at work, or grandparents are unable to come and visit? How do we deal with the loneliness and isolation that might be faced in the case of, for example, children with cystic fibrosis at Boston Children's? They're often hospitalized for weeks and months on end with strict isolation protocols. How do we expose those folks to other people in their life, whether they're patients in the hospital or their families at home? How do we prepare for complicated procedures? So things like, in the case of yesterday, which you'll see a video of, a food challenge. So in the case of a child with a food allergy, how do we prepare them to come into the hospital for what we call food challenge, which is exposing them to this potential allergen in small increments, and how do we prepare them for what is arguably a pretty complicated procedure and process? Drug reference tools. So this is certainly from our clinical colleagues. How do we have easy access to things about dosing, adverse reactions, and interactions related to medicines? And how do we quickly access that instead of going, clicking on UpToDate or clicking on Lexicomp or one of these other tools that we use and searching through it? How do we just simply ask Alexa or another virtual agent how to do it? Med management, again, so how do we make sure that patients are adhering to the therapies that we prescribe? How are they getting those medicines? How are we making it easier for them to get those refills instead of calling the phone line and waiting in the phone tree for a half hour? Another poignant point that you'll see a video of shortly, how do we deal with this pre-registration process? All these painful things about, what is your insurance carrier? Is this still the accurate phone number? Is this still your date of birth? And then all the basics about the reason for your visit. And patients and families in particular are plagued with just filling these forms out ad nauseum over and over. They may have 3 visits in the same day and unfortunately have to fill out the same form over and over. So what I want to highlight here is the 3 that we've highlighted were the 3 finalists that were selected yesterday by our esteemed panel of judges. Again, what I want to really make sure is absolutely clear, when you guys see the videos that we're going to show, and you guys will be voting on this, these teams had never met. They had this pain point that was kind of put on their table, and this group of 4 or 5 folks, again, from disparate areas of expertise, built something that I think I would argue is really impressive in about 4.5 hours. So there are startups probably that are in the room that have been working on trying to solve some of these pain points over 4 or 5 years. So I want to give these folks a lot of credit. Some of them may be in the audience, but these are the 3 finalists that we selected, and I'm going to play each video. Each video is about 3 minutes, and I'll give you some details on how we are going to be selecting the winner through live texting at the end. So this is finalist team 1. Just so you know, when we are going to have you guys text the results, they're going to be referenced in this order. So this is 1, 2, and 3.
Your son is sick, hospitalized. You're stressed. Trying to care for him is hard enough, let alone remember all the information your doctor tells you for the few minutes you see him once per day, or even remember who your doctor or nurse is. My Question by Amazon Alexa is here to help. My Question bridges the communication between patients, families, and their care team, solving quick questions on the fly, such as,
Alexa, when's my food coming?
Your food is due to come in 9 minutes. How else can I help you? Visiting hours are 12 p.m. to 8 p.m. How else can I help you? Okay, I will let housekeeping know to get you a pillow. Here is the link to the patient portal. We will inform your care team to talk to you about access to the patient portal.
Some quick questions are also designed to facilitate rapport between families and their care teams by answering the questions and also providing a fun fact about their care team members.
Alexa, who's my doctor?
Your primary doctor is Melissa Van Kane. She trained in general pediatrics at Montefiore in New York. She enjoys tap dancing down by the Charles River. Your infectious disease specialist is Joshua Hirigon. He is the specialist that is helping to treat John for pneumonia. He enjoys Taylor Swift look-alike contests. How else can I help you?
Who is my doctor?
Alexa never went to medical school, so my question also stores and sends more complicated questions directly to your child's care team to be answered later on rounds.
What's wrong with my child?
Your care team is working hard to make John well to go home as soon as possible. This question will be delivered to your primary doctor. They will follow up on their daily visit.
Solving simple questions frees care teams to focus on making your child well. Storing important, complicated questions for later eases the cognitive burden on families and lets your doctor know what areas need more explaining. Better communication means better outcomes. Boston Children's Hospital, and my question lets your questions be heard.
So we may have a future voiceover candidate. This was one of our clinical informatics fellows who has a pretty impressive voice. So I just want to remind you, 4.5 hours, they had to first come up with the pain point and actually create a solution. Never mind build out the app and put fancy music and I think a pretty impressive voiceover. So as I show you the next one, just remember that these folks had really very little time to create what I think are really impressive visions for the future. And again, this is not a final product, but something that I think is going to be a real foundation for potential use cases in the hospital.
Susie has a baked egg food challenge appointment scheduled for October 31st at 8 a.m. in the Boston Children's Hospital Allergy Clinic with Dr. Lee. Would you like to confirm this appointment?
Yes.
Okay, confirming that appointment for you. Also, Susie will need to stop taking her Claritin tomorrow. I'll give you another reminder about this tomorrow.
Alexa, tell me more about my appointment.
Your visit will be conducted at Boston Children's Hospital on Fegan 6 at 8 a.m. I sent this information to your email. Susie will eat baked egg muffin in increments and be observed for 1 hour after all increments have been eaten. This visit can be 2 to 3 hours long. Your nurse will be closely monitoring for signs of an allergic reaction throughout. Oh no, I see that Susie has a temperature of 100.4 on your Fever Prince app. Her appointment may need to be rescheduled if Susie has a cold. You need to call your allergist. Would you like me to dial the clinic now?
Yes.
Susie's food challenge appointment is in 5 days. You need to prepare baked egg muffins to bring to this visit. Would you like me to order the ingredients from Amazon?
Yes.
Your ingredients are ordered and will be delivered in 2 days. Hooray! Your Amazon delivery with baked egg muffin ingredients has been delivered. I emailed you a copy of the recipe. Susie's baked egg food challenge appointment is tomorrow at 8 a.m. There are several items that you need to bring to this appointment. Would you like to see a checklist?
Yes.
Okay, I sent the list to your email. Do you have any other questions about your visit tomorrow?
No.
Today's the day of Susie's food challenge. Traffic to Boston Children's Hospital is heavy today. Would you like me to order an Uber?
Yes.
All right, I'm ordering your Uber. Your car is on its way.
So I heard there was some laughter in the audience when they showed the ability to order stuff on Amazon. But the cool thing about that specific use case is like all of this is technologically possible today. And again, a really impressive implementation. This is a super complicated scenario. So a child who has to go through, again, a food exposure at an allergy program, simple things like cooking the food that this child is potentially allergic to is something that the family actually has to do, and they have to bring it in order to be challenged. So I can't tell you how many times we hear that folks, forget to bring in the muffins that had the egg, and this is, again, a great example of potential voice-enabled healthcare. I'll move on to team number 3.
Patients and families are frustrated by the cumbersome registration process at Boston Children's Hospital. The current system requires families to check in and verify information several times before even seeing a provider. We created FastPass so that families can fill out pre-visit questionnaires in the comfort of their own home at their own convenience using an Alexa skill. FastPass will improve the patient and family experience by streamlining registration and providing medical teams with updated information prior to the patient visit.
This is a reminder that Jane Doe has a gastroenterology appointment in 1 week on October 23rd at 10 a.m. with Dr. Docktor. There is a pre-visit questionnaire. It will take about 5 minutes to complete. You can stop and restart at any time. Would you like to do it now?
Yes.
Who is completing this intake?
Susan Doe, I am her mother.
Are you still at 50 Milk Street, Boston?
Yes.
Do you still have Blue Cross Blue Shield?
Yes.
Is the best way to reach you still 617-804-5553?
Yes.
You're all set with your basic information. Next, we will ask you some medical questions. Do you have any concerns you would like to discuss at this appointment?
No.
We are going to verify allergies, medications, and recent visits now. Would you like to keep going?
Yes.
Allergies include latex, penicillin. Is there anything you would like to add or change?
No.
Medications include pantoprazole 20 milligrams by mouth twice daily, Miralax by mouth 1 cap daily. Is there anything you would like to add or change?
No.
Your chart shows that you were in the Boston Children's Emergency Department on September 20th for constipation. Have you had any other hospitalizations or emergency department visits recently?
No.
We are going to ask about symptoms now. Would you like to keep going?
Yes.
For the following 5 questions, please answer yes or no. Since your last visit to the GI clinic on October 20th, 2017, have you experienced heartburn on a regular basis?
No.
Change in appetite?
No.
Constipation?
No.
Diarrhea?
No.
Weight loss?
No.
Thank you for taking the time to answer this questionnaire. Do you have any additional questions or concerns for your medical team?
No.
Thank you. I will pass this along to the medical team.
So what you'll notice is I can't escape my name. I guess that was one of the points there. But this is something that, again, this is actually what's great to see is so that the actress right there was a mom of one of our patients at Boston Children's who has unfortunately filled out those forms millions of times probably at this point. So to have her, what I guess it looked like her actually typing away and multitasking while answering those questions in the comfort of her office or home is a pretty compelling offering. So we're excited. Wow, people are actually voting already. So I skipped ahead too quickly. But what I want to go over here is, again, the teams are teams 1, 2, and 3. So you want to text the numbers 1, 2, or 3 to the text number above. And just a reminder, so team 1 was the My Question, which could pose questions about who is your doctor and what are the visiting hours of the hospital. Team 2 was guidance around procedures. In this case, it was a food allergy program. And team 3 was filling out all those forms and helping ease the burden of the documentation process in advance. I'm going to give a minute or two for folks to weigh in here. Ooh, it's getting close. All right, so what I should tell you is, so the winner of this challenge will get an Alexa Show. So that's the beautiful Amazon Alexa device with the video screen, and a number of other technology toys from Amazon, which I'll show you on the following slide. So I'll give another minute or so to see what everyone thinks. It's nice to see it's close. I think we picked well. All right, I'm not seeing any movement, so I think it's safe to call it. Looks like Team 1 has won, so congratulations to Team 1. They will receive, and actually, maybe I'm wrong. I thought they were going to get a nice Alexa Show, but maybe we'll just give them a dot. We'll work on that, but maybe it's our stock imagery here. But Again, I just want to say thank you to the participants, if there are any folks that are here in the room. This was really an amazing event yesterday. Again, in a very short period of time, folks really got together, collaborated. Hopefully were inspired to build new and exciting tools and technologies to help our patients and our families. And to our judges who were there yesterday, they faced a tough challenge of actually asking questions of these groups that had built something in a very short period of time. So we're excited to continue our work at Hacking Pediatrics and continue to hack the hack. I hope you guys enjoy the conference, and thank you for your time.